So today I'm going to talk about parenting on the same page. My name is Dr. Sharon Saline. I'm here as part of the Facebook Live events that we have on Friday afternoon at 4 p.m. So we know that kids with ADHD need consistent messages, similar schedules, and clear expectations. This can be difficult enough when parents live together, and even tougher when they don't. Perhaps your parents or your in-laws help with childcare, but they don't believe in ADHD and they undermine the things that you're doing. So the goal that we're looking for here in terms of parenting or having different parents come in and work with our kids, when I'm saying extended relatives and such, is not perfection, but steadiness. Steady messages to your kids, steady messages between school and home. So, of course, if you are divorced or you're not with your children's parent, um, you chose to do that for a number of reasons, not the least of which might be you didn't really care for how they parented, or you wanted to not be around them. You don't enjoy dealing with them. And so this is really complicated because the fact is, as long as you are married, I mean, excuse me, as long as you are parenting children, in some ways you are still deeply connected. And that is a problem for a lot of people because they got divorced or they separated because they didn't want to deal with this person. So what we're going to start with is how do you put your child's needs ahead of your dislike or your discomfort or your frustration with your partner. Now, um, let's see. You may be living with someone who has very different parenting styles than you, who doesn't believe in ADHD, who is undermining you. So I'm really looking forward to hearing from you. And, we're a smaller group today, I think, because of the technological stuff. So hopefully we'll get, lots of personal attention. Um, so what can you do to coordinate across multiple households? So I'm going to give you 4 different tips, and then we'll just get to questions. So the first thing you want to do is to prioritize your child's needs. And that means discussing with your partner or ex-partner or relative what your child struggles with and what you agree on. Where do you agree that there are some struggles? Where do you disagree that this is a problem? And we're going to lean into the challenges that you both perceive first. Can you negotiate a compromise about how to address this issue? If you're unable to do this, then I want you to seek some help for the sake of your child. And probably the best place to start is with your primary care physician or pediatrician, because not all parents agree on going to counseling or are willing to go to counseling with a partner. The second tip is to create similar routines. Now, these routines do not have to be identical, but they have to resemble each other in some way. Like you go upstairs at this kind of time, or when you go upstairs, then you take a bath and then you go to bed. You have a bedtime routine and a morning routine at each household. And that's the similarity. Perhaps that's where the similarity ends. But we want to try to create some sort of same. Okay, so your kids aren't really thinking, well, at this house I can do whatever I want, and this house I can't. So um, figuring out how to work with your partner really needs to be on the top of your list. So your child may have different chores to do at each house, but he has chores to do. Your daughter may do homework at similar times, or may do homework at different times, but there's comparable bedtime. So this is not about control or who's got the power. And that's what it sort of devolves into in a lot of couples, but rather what serves your child, or your son or your daughter best. The third tip is about unified approach to treatment. So in this unified approach to treatment, you and your partner or ex-partner agree on what the path forward is for your child. And this is where I see many couples who are no longer together falling down and stumbling. And it's also where I see couples who are still married and live together stumbling and falling down. So many parents don't agree on medication, on counseling, on coaching or tutors. Let's start with what you do agree on. I worked with a family for a long time, and they would go to school meetings and they would agree that the child had a problem, but they couldn't agree on what to do, and how the school was super frustrated about doing interventions because the parents really were not on the same page. And it took a lot of work to get one of the parents on the page. So we want to try to figure out, like, what is the thing that you can agree on, and to grow from there. And there's a lot of that in the book called Getting to Yes, of course. So where can you each concede something and meet in the middle? That's a great place to start. Who can assist you with this? Do you have a friend? Do you have a religious figure in your life? Maybe a priest, or a rabbi, or an imam, or something like that. Um, do you need more information about ADHD? Like, what the biological basis of ADHD are, how to treat it? And what does research say about effective treatment for ADHD? So we want to lean into expertise a little bit so that affects the choices that you're making. Another tip is about logical consequences. Of course, it doesn't work if there's no consequences in one household and very strict consequences in another. Now, what are you going to do as a family? Because even if you're not together, you're still a family. What are you going to do to manage misbehaviors, backtalk, aggression, lying, etc.? How do each of you as individuals handle these issues? Is there any overlap? And from that overlap, can we grow that into some sort of plan, program, routine? We know that punishment is ineffective for kids with ADHD because it doesn't teach any skills. So what can you do as parents to teach effective self-management skills, to teach those executive functioning skills that kids with ADHD need so badly? How can you create more predictability? So when kids know, if I do this, then I'm going to earn, if I do this, then I earn this reward. If I do that, then I earn this consequence or an extra chore. That really helps them because they understand what's coming. And this is very helpful for kids who live between two households, because there's a lot of chaos, a lot of shifting, a lot of planning and preparing. Do I have what I need? What do I need? When am I going to remember it? Ugh, do I have two things at both houses, or do I have to carry stuff? I worked with a young man. He finally learned to drive. He was a junior in high school, and he had a car. He had an old family car. And in the car, he had a big duffel bag with all things that he needed at all times. And he basically lived out of his car, because if you go to one parent's house, he wouldn't have what he needed. If he'd go into another's, he left it at the other person's house, and so he had a bag. So in this sense, what I think is helpful is to have a checklist. What do you need when you go to this parent's house? What do you need when you come to my house? That can be very helpful. And finally, when you don't agree with your ex-partner, when you really can't even talk to them, communicate via writing. Communicate about the facts. If you can't talk, send an email. This is what we did this week. This is where our son is. I'll meet you at the Friendlies, which is an ice cream which is an ice cream store, a parking lot, to do the exchange. Send messages, perhaps text messages, not about personal things or what they could do differently. That has to be dealt with more in person, but rather about facts. Okay, so your partner's updated when your child goes to their house. Like, for example, did they lose? Maybe you got very angry because they called you some terrible names, and they lost the privilege of their phone for a day. They did not earn that. And so you want to let them know they're off their phone for this. So the other thing that you can do that's really helpful is to create a routine or a schedule that you have at your house, and ask them to do the same, and keep them online so you can try to match up some things. That's very helpful for these kids, because going from house to house is so challenging. The other thing that's really challenging, of course, is when your partner, who you live with and love and you are still in a relationship with, has a very different idea of what ADHD is and how to manage it. And I think in those situations, that's a great time to get some family counseling. So those are my beginning tips for for our talk today, our Facebook Live. So let me go into the messages and see what we have. So please write down your question, and I'll be able to engage with you more in depth than I often can. So Rain says, dirty messages to my husband, and I live dirty messages. My husband and I live together, but our parenting approaches and beliefs are so far apart, we might as well be living in separate homes. So I'm hoping that today's information will help. Um, and then Rain, you said something about talk to text fail. So I have to say that when you live with a partner who has a different parenting approach than you, it's really important to try to go speak to someone about how and where you guys can be on the same page, because your kids are getting different messages. One of you is the good cop, one of you is the bad cop, one of you is the one that they go to ask for things, one of you is the one that they avoid asking for things because the answer is often no. And that creates more rigid roles in a family. And what we want to do is have some role flexibility. As a parent, you want to be someone who's fun and loving and playful and also means what she says. And you want that for your partner too. And in most relationships, one parent is more of the disciplinarian than the other, but hopefully, you can be on a similar page. Tricia says, how do we get our child to have motivation to do anything, skill learning or not? Our son just has no drive. Well, Tricia, that sounds very difficult. I'd love to know how old your son is and what he likes to do with his time, because that will get us started. Tricia, you also said that you and your husband are still married, but he has had an awful time accepting your son's diagnosis, which doesn't help. So I'm curious, Tricia, what's been hard for your husband to accept about your son's diagnosis? Where is he struggling? And what is he accepting it or not? Because I think that's a really important issue for a lot of couples. One thing um, that I think is really challenging for a lot of parents is when their partner doesn't really like fall on the same page and you feel alone. And in those situations, what happens is that you that you end up talking to other people, looking for support from other people, and that drives a bigger wedge between you. Joellen asks, do you have any advice for parenting young adults who live with us during the summer and Christmas, ages 19 and 23? Well, that certainly can be a very big challenge for a lot of families. And I think the question is, when young adults are living at home, again, that they're getting similar messages from each parent, but what are some of the basic guidelines that you want to have? Do they need a job? Do they need to pay you a little bit to participate in the household? Can chores be a way that they participate? What does it mean if you're a young adult living in your family, or as I like to say, an emerging adult? Okay, because they're emerging into adulthood. I think that one of the things that happens during holidays is there's a big regression, and you treat your emerging adults like they were when they were in high school, and that doesn't work either. So I think it's great to sort of sit down, have a conversation, and lay out, what are the ground rules here? What's the foundation? What's the agreement? Trisha says 15 and electronics, which we monitor and we do counseling. Hubby has it too, so that's the biggest thing. Right, so you're living in a house with a son and a husband who have ADHD, and you're kind of the frontal lobes for the system. And that's a lot of stress on you, Trisha, and it's also a lot of responsibility. So if he likes electronics, what I would encourage you to do is use electronics as an incentive for other things. So he doesn't drive, he's 15, so he's not really driving yet. But what other things would he like to do? Are there parts of electronics, gadgets, systems that he wants? How could he earn them? And so when you set up an earning relationship to what kids like to do and what they want, your chance of motivating them increases because it's an incentive. And I would say that if your husband also has ADHD and likes electronics, maybe we can come up with some sort of family plan around that. How do you handle intermittent explosive disorder of an 18-year-old? Thank you, Jennifer. I would say very carefully. So intermittent explosive disorder, for those of you who don't know, are kids who, really blow up over little things, and they're unexpected and they're intense. They can also blow up over big things, but regardless, they're super intense, and they really drain the family as well as kind of destabilize the family in some ways. So I think with an 18-year-old who has intermittent explosive disorder, I mean, first of all, I think counseling would be very helpful, or anger management classes. I'm sure it doesn't feel good to explode to them afterwards. And I'd be curious about that. What does it feel like after you explode? Do they come back and say they're sorry? Do they feel ashamed? It can't feel good to feel, most kids, most adults feel they don't feel so great when their emotions have taken over for them, and they're like in a, they're drowning, and so they're just spewing whatever feelings they have. And so I'd want to talk with him or her about what's going on after it happens, and then how to work with when it's starting. What are some interventions you can do that aren't going to make them more upset? Also, medication can be helpful for intermittent explosive disorder, so I would pursue that as well. Cassandra, probably the hardest part for me is having ADHD and raising children with ADHD. Yeah, I'm sure it is. Because you're struggling with some of the same things they are. I mean, we know that children with ADHD thrive when routine and structure are established and consistently enforced, but that's also what I struggle with the most because I have ADHD. Thank you so much, Cassandra, for bringing this up, because I think you're not alone in this. In fact, I know you're not alone. So one of the things that I think would help in when you have ADHD and you're raising kids with ADHD is to do some, I don't mean to be shamelessly self-promoting, but I have this in my book, What Your ADHD Child Wishes You Knew, a little quick evaluation of executive functioning skills. I call it Rate Your Brain. And when you rate your brain, and in the family, you can see where some of your strengths are, maybe where your kids are, and some of your challenges, and where there's overlap. Because if you're struggling with organization and your kids are struggling with organization, then you can gather up some resources to help you work on that issue for yourself and water it down to work on for them. And so I would encourage you, because routine and structure involve organization, planning, and prioritizing, as well as time management, these things are often very difficult for people with ADHD. So, do you have a partner? Do you have a relative who could be a sounding board for you in setting up some kind of routine that works for you and also works for them? You're welcome, Joe Ellen. Rain. I'm right there with you. I have it, my husband has it, and all three of our kids have it. Emotional regulation and consistency are super difficult. Yes. So let's lay that out right away. It's very difficult, and that's actually where you can come together as a system. So you can create an intervention that's a family intervention. When we're all getting activated, we're going to do Dr. Sharon's Stop, Think, Act. And you can look it up on my website or in my book or even in my card deck, and you'll see, what to do. You can also get my card deck, which is great, and you could pull a card on like self-control. But what I'm saying mostly is that you want to have some sort of ideas or plans that you set up in a calm moment for what's going to happen when the meltdowns occur, because they are inevitably going to melt down. And in terms of consistency, one thing that I would encourage you to do is to write stuff down, like get a whiteboard. Put down when people have what, and refer your kids to the whiteboard instead of to you. When you have trouble structuring things and remembering them, they can look at the whiteboard and they see the sequence there. So it teaches them how to organize and sequence themselves. Trisha, you said he struggles with even thinking of things to do. He's just so overwhelming. He also has a processing delay, so he gets overwhelmed when too much is going on, or he has to think of ideas and stuff. He knows what he has to do, but won't take the steps to do it. So it sounds to me, Trisha, like he's a bit depressed. And I don't know if he's taking any medication. I can't remember if he's in counsel and you're doing counseling. So I'm curious a little bit about the counseling and what he's working on there. Um, and I think that it is really difficult when kids just are lethargic, have low motivation, and they get easily overwhelmed. So we want to break things down into small pieces. Um, and maybe you could start with something that he could help you with. And then earn something that he wants in return, so that you're just teaching him to put the have to before the want to, and also to assist in something that is bigger than he is, which would be a project or a task that you need assistance with. Thank you for the post on Ryan Wexelblatt's work. If it's great for fathers and sons with ADHD. Yes, ADHD parenting is a struggle. Staying consistent is difficult. Okay, so here's the thing about consistency. Not perfection, steadiness. More times than not. That's the goal. Because if you're trying to stay consistent, there's a sort of implication that I need to be perfect. And that's just going to really mess you up. So instead, what I want you to try is to think about what you actually can manage and you do already pretty much regularly. Not completely regularly, but pretty much. And then focus on that, okay? And give yourself some pats on the back for that. Then you could pick something else that maybe is a little bit harder for you and set different expectations for yourself on that. So we don't need to stay consistent all the time. We need to stay consistent sometimes. Pick the things that come easy to you as a place to start for consistency. Jennifer says, my 18-year-old is on Abilify. After explosive behavior, he stops talking to my husband and I because the police were called. So Jennifer, this seems like a very touchy and difficult issue. I hope that you're getting some professional assistance. I do think an anger management class would be useful. And when you have to call the police, you're at a whole nother level of parenting. And I'm sure that's very difficult. It's really hard to call the police on your own kid. However, your child needs more support and tools than he's receiving right now. And so I would look into some programs that are available for 18-year-olds. Carmelina, I've just received your book down in Australia. Yay, thank you. And I'm hoping for some help. It's not too late to learn. Absolutely not. I don't think it's ever too late. And 16-year-olds actually are interested in the process of themselves. That's the gift of being a teenager, right? You're interested in yourself. And so we want to get teenagers a little more curious about themselves and helping themselves. And that means developing what I call self-evaluation, or often it's known as metacognition, understanding themselves, why they're doing things, what they're doing, how it matters, what the effect of it is on others. Christine, my son is dyslexic and possibly ADHD, 10-year-old with neurotypical twin sister. I'm divorcing the dad who is controlling and narcissistic, never wanted to do family therapy. Today we do a family therapy, just the three of us without dad. The therapist is going to talk with dad and hopefully that will help us all. I struggle to co-parent with such a controlling personality. This creates so much anxiety in me. What would be your advice? First of all, what I would like to say to you, Christine, is a big hug. Big hug. Choosing to divorce someone who makes you feel bad about yourself is a huge step in the right direction. And if he doesn't want to participate in the family therapy, that's fine. You can work on things with your kids and form your unit and let the therapist deal with your ex-husband. Of course, dealing with him creates anxiety. And so what you might need is a mediator or someone else to help you set up some kind of parenting agreements. In my area, there was a therapist who worked with divorced or divorcing couples. That was all she did. How to co-parent when you're not together. And he may or may not collaborate with you or participate, and that's fine. Ultimately, your kids will see who he is for what he is. I know you may not believe me, but it's true. Trisha, he's on Concerta. And yes, we've talked about depression. Psychologists and my son are trying to figure out the why and how of his ADHD characteristics. So trying to understand how and why he feels the way he does. I think that's great, Trisha. I mean, it seems like you're doing the right things. It's just slow, and it's so painful to see your child be depressed and kind of stuck. I went through this recently with one of my kids. And it's been well over a year. It was over a year or 2 years maybe, and just very hard. And so my heart goes out to you. And I think the thing that helped actually was her improved insight on about herself, and also me, trying to just take responsibility for the ways that I disappointed her or hurt her, wasn't there for her in the way she'd hoped. Cassandra. Oh, thank you, Kimberly. I really appreciate that. Cassandra, the best thing I've done to reset my girls when they get overwhelmed or when they need what I call a boost for their brain is to buy a trampoline and a web swing for them. Woo! I love this idea. We homeschool, and because they need to move more than other kids, we work on a task, and then we send them outside for 10 to 15 minutes to jump or swing, and then they come back inside and are ready for the next task. Thankfully, we live in the South, so this is a year-round resource for you. This is fantastic. I actually have a client who has like a boxing, what do you call those, bags and mitts, and will take breaks during the day. He's also being homeschooled right now, and have a little workout and then come back. So that's great. I love that. And exercise is so good for the brain. It just bathes our brain in endorphins and counteracts the stress. Trisha says stuck is the right word. Yes. Okay, so please write your comments in, or your questions. I know there are other people here. If you have some comments or questions about parenting on the same page, please put those in the comments section. One thing that I want to say that's really hard is that when you and your partner don't agree, and no partners agree all the time. I mean, it just doesn't have, I really, very few couples really agree 100% of the time on what they're going to do with their kids. So the thing that we want to think about is, what are we going to do as a couple or as a parenting team when we don't agree? It's not that you have to agree all the time. It's what you're going to do. What is the process for when you don't agree? How are you going to solve that issue? That's what's important. Because what happens a lot of time in divorce is like, I don't agree with you. You don't agree with me. Forget it. And then there's no progress. And then your child continues to sort of, slog through without actually getting the tools that he needs and the direction that she might need. So let's see what we have here. Yeah, okay, Jennifer asks, how can you know if it's ADHD alone or added autism spectrum disorder? Well, that's a good question. If the primary diagnosis is ADHD, about 14% of those kids ages up to 18 have an added autism spectrum disorder. Autism spectrum disorder had basically the characteristics have to do with social challenges. These kids don't really know how to read or process interpersonal social information. They may not be great communicators. They may engage in repetitive behaviors as a way to soothe themselves. So there's a lot of finesse in that diagnosis, and I hope you're working with someone who can help you with that. One of the other differences is that kids with ADHD know what social cues are, but they may miss them. They know how to do, shared play or conversation, but they may be impatient with it. When those skills are lacking, it can indicate autism spectrum disorder. You're welcome, Christine. Okay. Thank you, Annie, for posting. Kimberly, you're welcome. Thank you for writing it. It's helped me understand what's going on with my 9-year-old son. Fantastic. I think it's the combo that fires off the anger. That's probably true, Jennifer. Cassandra says, I've always thought that ADHD should be on the lower end of the spectrum because some symptoms of ADHD are so similar to the symptoms of autism. Yeah, I mean, I think some autism experts would disagree with you, and I think some ADHD experts would disagree with you. But there is overlap a lot on the social anxiety. But what happens for kids with ADHD is they miss the social cues. It's not that they misread them; they miss them. They don't see them. When they see them, they can understand them. For kids who are on the spectrum, they may miss the cues, but they also may not be able to understand them, to read them correctly. And that's very different. They know how, kids with ADHD know how to respond in a conversation, but they don't always slow down enough to be able to do that appropriately. Hi, Heather, welcome. We're having a conversation about pretty much everything. Open topic today. I mean, we're talking mostly about parenting on the same page and what struggles many people have with partners or extended relatives, as well as ex-partners in this area. You know, one challenge that I see a lot is people ask me about is like, Mo, my family doesn't really understand ADHD, or my in-laws don't believe that it exists. You know, what can I do? Because they say, oh, well, look, you know, my daughter, grew up fine, and she's, she didn't have any special treatment. Why does your daughter need special treatment? And I think it's important to really share information. I mean, information is such a gift to awaken people to the reality of what ADHD is, or what autism spectrum disorders are, or what learning disabilities are, or what 2E what makes a child 2E. You know, I think that we live in an age where things have changed dramatically. We understand things psychologically that we never understood before. And so, you know, I'd love to hear from you. What are some challenges you face in your family, your extended family, with helping them understand your child? Who has challenges with helping extended family understand their kids? And what kind of challenges do you have? Send me a question. I'd really love to answer this. Heather, you're having a very difficult time with hygiene with your 13-year-old son. Oh, I'm sorry, but I know so many middle school boys and some girls who are terrible with their hygiene. So we want to remember that 13-year-old boys with ADHD are actually more like 10-year-old boys in some ways, and 10-year-old boys are not super great with their hygiene, right? The difference is that your 13-year-old son is in puberty, and so there's a lot more to deal with. Whether it's, body odor, or, um, pimples on the face, or greasy hair, or whatever. So what I would do in this situation with hygiene is I would make an agreement, a bare minimum agreement about hygiene. You know, brush your teeth at night. Maybe you're not going to do it in the morning. That sounds kind of gross to me, but here's the fluoride rinse. So when you go to school, you actually have decent breath. Shower, maybe not every day, maybe every other day. Wash your hair twice a week. Like, put it down and make a list. Put it in the bathroom. Again, then you can refer your son to the list instead of you getting into a negotiation and an argument about what he should be doing when and why. Any other questions about dealing with extended family who don't understand ADHD, or any other questions? Monica, my 13-year-old son has braces, and I have a very hard time getting him to care for his braces properly. You know, Monica, I have a client on my caseload, and she's 16, and her braces are coming off next month, and she's not in good shape. Like, her gums are inflamed. And I asked her, I said, well, how do you think you're doing with caring for your teeth? And she said, oh, terrible. I said, are you concerned about that? And she said, yeah, actually I am. And I said, well, how can we help you brush your teeth? And she said, well, maybe if I only had to do it once a day. So we had a long conversation about that and agreed that once a day she would brush her teeth in the evening and rinse in the morning, and put up a Post-it on the mirror in her bathroom. I've been out of the office this week because, as I said earlier, I have a new puppy. So I'm looking forward to meeting with her next week and seeing how things are. But I think, I would ask, obviously, the orthodontist to talk to your child about it and make some sort of bare minimum plan. And that for the bare minimum plan, your child would earn this, and for extra bonus, 2 teeth brushings, you earn something else. Mm. And I noticed that Annie put something up about hygiene help for sensory, for sensory sensitive kids. And I think one of the things that's really challenging for kids with ADHD, because they are kind of many of them are sensory sensitive. About 10 to 20% of kids with ADHD struggle to process information through their senses accurately and efficiently. One of the things is to talk about, is there something about brushing your teeth that doesn't feel good? Or is there a sound? A lot of kids are very sensitive to sound. So let's try to, unpack why the hygiene isn't occurring and how the hygiene, set some basic, this is the basic, and then figure out what your role is going to be. If this is the basic hygiene, what is my role going to be in terms of reminding you or not reminding you? Okay. Joelle, an extended family assumed that the daughter was not motivated to move forward in finding a job. Yeah, the ouch. What I want to say to that is ouch. There are a lot of ways to adulthood, a lot of paths to adulthood, and getting a job is a huge deal for a lot of kids with ADHD. You have to talk on the phone. You have to email, you have to fill out forms, you may have to meet people in person and answer questions. It is scary. It is really scary. And if your self-esteem is already challenged or low, it's hard to think about how to apply for a job. And sometimes your kids need you to help them. I mean, I worked with a young woman, and she was really struggling to look for a job, and I was like, okay, let's go. I'll walk with you. You can go into the store in our town, and I'll just stand outside. And she's like, can you do that in therapy? I'm like, we are. And that was very helpful because, she wasn't alone doing it. And she didn't want her parents to come. But then we talked about it, and actually she asked one of her parents to go with you the second time she went around. Heather, I heard of having your child sign a contract of cleaning, etc., needs so they feel more likely to do what is asked. Yes, that's what I was talking about earlier, that have to before want to, link some of these tasks to what he wants. Like he'll have to earn it. Yes, Becky, you can watch it later. Tricia, another issue is that our son has many talents but doesn't apply them. We had a talk the other day, and he was finally open with us. Oh, that's great. And said that he's afraid that when he's really good at something, people will expect more for him. And then he won't measure up. And so he doesn't want to disappoint them, so he doesn't bother trying. That's such a toxic cycle. So self-defeating. He's a great drawer. Singer, built me a nightstand in shop class. Fantastic. He even plays football, which he's pretty good at, but struggles with giving 100% to anything and going on in life. That won't get him very far if he is only giving half effort. So I really wouldn't worry about later in life. He's 15. What I would worry about is, I think he's 15. Is that right? I have to look back. I don't remember. I think he's 15. I'm looking back, but I can't find it. Sorry if he's not. Even if he's like 18, I wouldn't worry about later in life. The ADHD brain matures, more slowly at its own pace. And so if he's doing efforts and he is getting positive feedback from that, that might be enough for him to help him keep going. He plays football, he draws, he sings. Maybe he's not ready to give himself 100% because he's afraid if he does and it doesn't work out, then he's not going to be able to tolerate the disappointment and the negativity that he will be giving himself. So, if he's putting out some effort, and over time, when things continue to work out, he can put out some more effort. I hope. Joellen, yes, good information on the job search. I did this with eldest in her first summer. I stood outside of businesses. Right. They don't know anything about how to get a job. None. Okay, other than what they might read online. So we want to actually assist them. What do you say when you have a job interview? How do you line up? What do you do when you create a resume? Kids need assistance with that. and how can you help them? Maybe you find some sites, they put something together, you sit down, you say, well, actually we can make this sound a little more important, or we can embellish that. That's a great way as a parent to assist your child in adulting. Heather, I tend to bring his toothbrush to him in bed. Is that terrible? I don't want him to have bad gums. I don't know if that's terrible or not. That depends on what your works for you. If you bring his toothbrush to him in bed, is he brushing his teeth? Again, he's 13, -3, he's 10. What would you expect from a 10-year-old? Maybe it's better to have the toothbrush down by the kitchen sink, so after his breakfast, he can brush then, if that's something that's meaningful, or after dinner, he can brush right then. 15, thanks, Trisha. Cassandra, for the most part, my family understands ADHD because of my diagnosis. I see. My sister is a behaviorist, so I have always appreciated her input in helping my girls. That's great. But there are times when other people don't understand my girls, when emotional regulation is hard, and also when they have meltdowns in public. So it's not really family, but friends and other people who don't understand. I've worked very hard to help them maintain friendships and learn social cues so they can maintain friendships, but sometimes their symptoms get in the way. Yes, that's exactly right. And this is particularly true for girls who interact with each other much more verbally and who depend on relationships to define themselves than for boys. I think that, I'm glad your girls have each other, and I think that other people don't understand girls with ADHD, even more than they don't understand boys. And so continuing to just educate, have a couple phrases that you can say in those moments, or, that are your backup for when you're teaching people about girls and ADHD. Keep them in your back pocket, so to speak. Okay, we are about ready to stop. Thank you so much for your great participation. I have time for one more question. If someone wants to send me a question, I will be happy to answer it. Um, it's been, I think, really important to have this discussion and to be able to talk with some of you at length. I want to encourage any of you who are here to please like me on Facebook, or follow me on Facebook, and to check out my website, where there's lots of free information about ADHD, and continue to support Attitude Mag. It's .com. It's such an amazing resource, and it's a great honor for me to be here every week. Carmelina, you're the last question. You're welcome, Tati. Is it common for kids with ADHD to be loners? My son hates to socialize and hangs out. It can be, particularly if they're insecure about their social skills. So what I would encourage you to do is to figure out if he can be alone, like gaming with other people. Does he have friends he games with who are virtual? And what's holding him back from being with people? Is he afraid of actually being, letting people down, of being teased? Is he feeling, insecure and unconfident? My guess is he's pretty lonely. And when kids are lonely like that, they've sort of lost confidence that actually other people want to relate to them. So there'd be a great opportunity for him to talk to someone, maybe find a counselor who can help him. He might be, I can't tell if he's depressed or anxious, but these are all good things to work on. So thank you so much. Have a wonderful weekend, and I will see you here next week. Bye.